Hello guys, I am Dr. Victoria Clinton and I am currently doing my diploma in diabetes management at the University of South Wales. I have mainly created this video for persons with diabetes. Also, if you know of a family member or a loved one with diabetes, or you take care of a person who has diabetes, then this PowerPoint presentation is for you. Today, I will discuss a common disease that affects the small blood vessels in the eyes of persons with diabetes called diabetic retinopathy. So, what is diabetic retinopathy? Diabetic retinopathy is a condition in diabetes where you have high blood sugar levels damaging the blood vessels and the retina at the back of the eye, eventually leading to blindness if not treated. So how does this condition occur? First, let me explain the mechanism by which we see images using this diagram. Let's say this big-headed guy named Tim. I would like to call him Tim. And Tim wants to look for Sam. Sam is right here. For Tim to visualize Sam, light bounces off Sam and enters the front of Tim's eyes through the pupil, where it bends and causes an upside down image to be created on the retina. The brain then turns the image the right way up. From the image, you can see that the retina is smartly positioned to create the image to be transferred and interpreted by the brain. When you have poorly managed diabetes, over time it damages the retina's blood vessels, causing blood to leak from them, depriving good blood supply to the retina. The retina subsequently cannot get good oxygen or nutrients because of the lack of blood supply. These blood vessel leakages to the retina is what we call diabetic retinopathy. On the right hand side of the slide, you see tiny blood vessels in the wide part of the eye, which merges into this bloody patch because the blood vessels are leaking. Imagine this happening in the retina. This is what diabetes retinopathy is about. Diabetic retinopathy can be classified into three fundamental stages. The first stage is called background retinopathy, and this is where small protrusions beginning in the blood vessels, which may bleed slightly. However, the bleeding is so mild that your vision is usually unaffected. In stage 2, called preproliferative retinopathy, this is more severe than stage 1. Here you have global changes affecting the blood vessels and the eye may have more extensive bleeding. In stage 3, called proliferative retinopathy, in this stage you have new blood vessels formed accompanied by scar tissue. The problem with these new blood vessels is that they are frail, they are unhealthy, and they bleed easily. These blood vessels forming on the retina can result in some vision loss, eventually leading to blindness. This slide shown here illustrates two retinal views. This is what the doctors see when they look at the back of the eye. On the left hand side, the normal retina is shown, and as you can see, the blood vessels are healthy looking. There is no leakage of blood vessels. Let us contrast this to the right side of the slide, where the blood vessels appear ill looking. There are many patchy bloody spots because the blood vessels are leaking. This is how the eyes of a person who has diabetic retinopathy look. This is what diabetic retinopathy is about. Who is at risk for diabetic retinopathy? Essentially, all persons having diabetes of any form is at risk. Your risk is elevated if you have long-standing diabetes, if you have poorly controlled high blood sugar levels. An interesting fact to mention here is that poorly controlled diabetes also increases your risk of cataracts and glaucoma. If you are hypertensive, if you have high cholesterol levels, and this might be a surprise to many people, but if you are pregnant and have diabetes, then your risk is also increased. Also, if you have certain ethnicities such as Asian or Afro-Caribbean descent, then your risk is increased. Taking care of your blood glucose, your blood pressure levels, and your cholesterol can decrease your chances of developing diabetic retinopathy by as much as 50%. Symptoms of diabetic retinopathy include slowly worsening vision, vision without warning, shapes floating in your field of vision, or black spots or flashing lights, any blurry vision, eye pain or redness. And if you have difficulty seeing in the dark, well, then you need to get checked up for diabetic retinopathy. So when to go for a routine checkup? All persons with diabetes should receive their first retinal screen within the first 3 months of diagnosis. After that, you are required to have screening every year. So what happens during an eye test? Well, you will be put in a dark room, or you'll be given medication in the eye to help dilate it. So the doctor, which is an ophthalmologist, can easily view the back of the eye. He uses an equipment called a slit lamp, which is on the bottom of the right-hand corner of the screen, and this equipment helps improve this view. How to prevent diabetic retinopathy? Well, you can help reduce the progression or risk or stop diabetic retinopathy from getting worse by controlling your blood sugar levels, including taking your diabetes medication as prescribed. 2. Controlling your blood pressure levels and your cholesterol levels. 3. Going to all the screening appointments and getting the medical advice as quickly as possible if you notice any changes in your vision. And 4, which is very important, practice healthy lifestyle habits. When you control your weight, when you eat a balanced diet, when you exercise frequently, when you make measures to stop smoke, you can decrease your risk for the condition. And finally, what are the treatments available if you have diabetic retinopathy? Well, the first treatment we have is laser treatment, and patients who undergo laser treatment can reduce their risk of severe visual loss by 50 to 90%, depending on the severity. Laser therapy also assists in stabilizing central areas of the retina, and this is important because in these areas, called the macula, it helps us to read properly. The other treatment available is eye injections, and these treat badly affected central areas of the retina that are sight threatening. It is proven by several studies to be effective, such that persons get complete regression by the 6th week of eye injection therapy. And the final treatment that is available is eye surgery. And these are usually recommended in persons expected to have no benefit from laser treatment when retinopathy is severe. During the eye surgery, blood or scar tissue is removed. These various treatments come with their particular risks and side effects. So if you have advanced diabetic retinopathy, it is best to discuss this with your eye specialist to help make an informed decision with your overall eye health. And this is the end of my YouTube presentation, and I thank you for watching. Goodbye. My references are located at the end of this presentation.